But in terms of what led to my mom's stroke, my mom had been diagnosed many years ago with hypertension. And she believed that she could control her hypertension with her diet. So she was really into beets. I think I shared that with you, Dr. Stevenson. She was eating beets several times a week, garlic, and all these things. And all of those things probably helped her outcome, but they didn't take away her hypertension. And when they came for her, the ambulance, when we called and they came and got her, her blood pressure was 235 over 98. Okay, the fact that she's still here is incredible. But she was not taking any hypertension medication for several years after having been diagnosed with it. She was not taking the medicine, and I cannot stress it to you enough. If you are diagnosed with hypertension, you cannot manage it on your own without the supervision of a doctor by deciding you're not going to take your medicine. And anyone in your life who's doing that, you can't let them do it. Again, I knew my mom was doing that. I knew that she was doing all these things. I didn't appreciate that she wasn't taking any medicine, but I also never asked. And so here's the thing, for those of us who have people in our lives, this is the place where I know normally we're taught, like, stay out of people's business, mind your own business. No, I'm done with that. I'm nosy. I'm all in her room. What is this? What is that? What are we taking? What is this? Because once you get to this place, you do have to advocate for your family members by being a little bit more in their business. And so the fact that she had the hypertension is what, and was not taking any medication, and she was not managing it, she wasn't under doctor's supervision, and she was basically just trying to do it on her own. That ultimately is what precipitated the stroke.
Thank you so much for sharing that, Dr. Parker. Judge Parker, I'm sorry.
JD.
I sent you to medical school. I sent you to medical school today. But in my personal experience, treating many, probably thousands of stroke patients, and my people, they don't want to take their blood pressure medicine. And I see patients, they look just like me, they're my age, in their 40s, and the only risk factor they have is high blood pressure that they don't think that they need to treat. And it's frustrating because it's so preventable. I have high blood pressure. If I don't take any pill, I take my blood pressure pill, because I'm not gonna be that patient. So all of y'all, and there's a lot of us that look like me in here, y'all need to check your blood pressure, go to the doctor every 6 months or once a year, whatever they say, and if you have high blood pressure, you need to treat it. Because I don't want to see you when I'm on call, and I don't want them calling me at 2 in the morning because you had a stroke because you didn't take your blood pressure medicine. All right, I'm grumpy at 2 in the morning. Y'all need to take your blood pressure medicine if you have high blood pressure. If you don't have high blood pressure, you need to go to the doctor regularly so you can be monitored. So if you do develop it, it can be treated. So I'm so glad you shared that, because in my experiences, honestly, with thousands of patients, that is the most common risk factor I see. High blood pressure is not okay. It is called the silent killer for a reason, because unfortunately I have seen it kill people that look just like me, my age. So thank you, Judge Parker.
One other thing, or two other things I want to share. One is that my mom, when we got to the hospital and they were finally able to do the scan of her brain, they came and told us two things that were vitally important that we never knew, right? In fact, I asked my mom that day, I said, Mom, when's the last time you've been at a hospital? And she looked at me and she said, when I gave birth to you. No. I was like, oh, Lord mercy. She had never had imaging done of her brain ever in her life. And what the imaging revealed is, one, she had had multiple mini strokes prior to that. There were many, they were documented on the imaging, and the second thing is that she has an aneurysm. I had understood an aneurysm to be a phenomenon that happens to you. Like, we always think of, what really people are talking about is a ruptured aneurysm, but we use the term aneurysm sort of broadly to sort of describe that a blood vessel has ruptured. But an aneurysm is, as I understand, which I'll leave it to you doctors to explain it, but what we've learned is that my mom has an aneurysm that now has to be remediated once she recovers to an extent that her neurologist is comfortable with. But she's got an enlarged blood vessel sitting right here in between at the front of her brain, in between her eyes, that we've got to do something about. We're fortunate that these strokes didn't cause it to rupture. It very well could have, and we would be dealing with a totally different circumstance. So the point is, about the blood pressure medication, what Dr. has said in terms of you've got to take it, but also to just be able to be under the care of a doctor where you can get imaging done so you can understand the condition of your body.
Thank you so much, Judge Parker. Crystal, can you tell me about your experience? You get to see all the stroke charts, all the stroke patients in the hospital. Can you tell me about your experience with seeing high blood pressure in the stroke patients in the hospital?
Yeah, I was actually just talking about this probably like 15 minutes before we started this, that it is probably the number one most non-compliant thing in every patient that comes in with a stroke. It is also the number one most preventable thing. 80% of strokes can be prevented. So that's a huge number. And it's a matter of compliance. If you know that you have high blood pressure and you take your medicine and keep it down, you lower your risk by a lot. But it is the most common thing. And if you're having a stroke, you come in, your blood pressure is like what she was saying, like 235, it takes us a while to get it down. While we're still trying to get that down, you're still at risk the entire time it's taking us to get it down. It doesn't happen like that. If we take you down too fast, we can cause another type of stroke. But I would say non-compliance with hypertension and diabetic medication. Diabetes is another big one that I see in a lot of the stroke patients, especially here recently. But what's scary, I think, and what I wish more people would understand is that stroke does not discriminate to age. I am unfortunately seeing the age range of the stroke patients coming in right now dropping. I am seeing more 30 and more 40-year-old patients than I have seen in years. And it's heartbreaking, but a lot of them have undiagnosed high blood pressure because they don't go to the doctor.
Yes.
So or they have a family history. You cannot run from your family history. You can't. I would like to tell you that you can, but you cannot. So if you know that your family has hypertension or high blood pressure history, get yourself checked.
Crystal, what I love when I'm working in the hospital, do you have high blood pressure? Do you have any medical problems? No, I don't have any medical problems. When's the last time you've been to the doctor? Oh, when my mom took me when I was 18 and they're 35.
Yeah.
So.
My dad alone. Same.
So don't say you don't have any medical problems if you don't go to the doctor. So go to the doctor, go get your checkups, and then if your doctor finds something, follow their recommendations. You know, we spend a minute in school, so we know a little something. So listen to us. So sometimes you can do all the right things and a stroke can still happen. Or maybe you learned the hard way. You didn't know you had blood pressure. You didn't go to the doctor and you had a stroke. But now I want to ask Judge Parker about what it is about life after a stroke. Because even if you have a stroke, there's still life and there's still hope for recovery.
Absolutely. I mean, first thing is I kind of look at it from the top down, right? The first thing, of course, is dealing with your brain, right? So you've got your neurologist working with your PCP to make sure that you're doing everything you need to do from that standpoint. But the other part of it is the emotional, mental health portion of it. It's really easy to get discouraged and down while you're trying to rebuild yourself. It's really difficult to be the caregiver for someone who has had a stroke because you're dealing with some of the same fears that they're dealing with about their prognosis and their ability to get well and to recover and to recoup certain skills that they had before. So I think that getting a support group is critical, getting the mental health assistance that you need, both as a caregiver and as the person who has gone through the stroke. And then you've got to do the OT, the PT, the speech therapy. As I said before, this idea that we have in our community that we're doing bad by our loved ones by letting them go to a skilled nursing facility, we need to get rid of that. There are really great places out there. It's not the way that it once was. Thanks to a lot of people in my profession, a lot of lawsuits have caused a lot of changes to happen in facilities for the better. And so facilities are not where they once were 20 and 30 years ago. The people who are there are administering exemplary care. And so this idea that you're, sending your loved one there and you doing wrong by doing that. We got to get rid of that. My mom went to a skilled nursing facility after she'd been in the hospital for a couple of weeks. She went to a skilled nursing facility for 3 weeks, and we are incredibly grateful. She had intensive therapy every single day. Every day. She had OT and PT, and she's walking. She has a cane, but she can walk around the house without it now. She's gotten to the place where she can walk around the house without it. When we go for our walks in the neighborhood, we take it with us just in case we encounter curves and things like that, where she needs a little more help balancing. But it's mainly a mental game in terms of sticking with it, keeping yourself up as the care provider, keeping yourself up as a person who's in recovery, and then following the routine and the protocol that's been assigned by your doctor in terms of the therapy, and then those follow-up visits. This isn't the place where you get to blow off your follow-ups, right? You got to go to those follow-up visits. We're quite adamant about it, and then you do the work. We've applied for the DART paratransit services so that if there are occasions where we're not able to take her, we got backup. We make sure she's not missing any visits. So following the protocol that's been prescribed by your doctor, doing those follow-up visits and staying with it from a mental health standpoint by accessing support groups and therapists for you and your loved one who's recovering. I mean, those things have been key for us.
Thank you so much, Judge Parker. Thank you so much for taking the time out of, I know, your incredibly busy schedule to come here and share your personal experience with stroke and to help to work to educate all of us about stroke. From the deepest part of my heart, I'm so appreciative. Thank you so much, Crystal, for coming. Thank you so much. I really appreciate it. Y'all, give them a round of applause. Thank you so much. Go to the doctor and do what they say. Take your blood pressure medicine so you have high blood pressure.
And Dr. Stevenson, I just had a visual aid that I wanted to share with you all because you were talking about the history and how you can't run from your history. Both of my parents have hypertension. And so as much as I try to get to the gym and take care of myself and get up and get after it, I monitor my blood pressure. I have a watch. I got this watch for $30 on Amazon, and I am able to put it on and I can push a button and it gives me my blood pressure reading. I monitor my blood pressure, so it's not just important to go to the doctor, but you need to be aware of what your blood pressure is, and if you see that it is spiking outside normal ranges, as you and your physician have discussed are normal for you, then you need to be adamant about getting some assistance. So I just wanted to use my visual aid here.
While she's talking about the visual aid, if you do have high blood pressure, keep track of it. Keep a little notepad. Recently my dad also had a stroke and we've been dealing with blood pressure. His blood pressure cuff came with an app on his phone. He syncs it every time he does his blood pressure and he can pull it up for the doctor every time he goes in and it lists everything. That tells your doctor how well it's controlled so that they can make adjustments as necessary. So keep track of it, keep a log.
Thank you so much, Doctor, for having us.
Thank you so much. Thank you so much.